right, so requesting all of you to please take seats and a general reminder to please put your phones on silent. Thank you. All right, a very good morning, everybody. Good morning. Can I hear a good morning back from all of you? Good morning, wonderful. Good to see some energy on a Monday morning. All right, so very good morning once again, and welcome to Manipal's Breakthrough Technology Interventional Radiology, minimally invasive and maximally effective. My name is Nicole Adams, your host for the day, and this event of Manipal Hospitals in association with Deccan Herald Brandspot will be telecasted live on the Facebook page and also on YouTube page of Manipal Hospitals. And yes, ladies and gentlemen, we'd like to welcome our leadership team, Dr. Manish Rai. Everybody with a big round of applause, the Hospital Director, Manipal Hospital, Old Airport Road. All right, so we also have Dr. Reddy Prasad Yadavalli, HOD and Consultant, Interventional Radiology, Manipal Hospital, Old Airport Road. Everybody, let's hear it up with a bigger round of applause, please. Thank you. Dr. M.C. Uttappa, Cluster Head, Interventional Radiology, Manipal Hospitals, Bangalore. Dr. Rajesh Venkatesh Helavar, Consultant, Interventional Radiology, Manipal Hospitals, Hebal. Dr. Nagabhushan K.N., Consultant, Interventional Radiology, Manipal Hospitals, Whitefield. Dr. Gayatri Karthik, HOD and Consultant, Obstetrics and Gynecology, Manipal Hospital, Old Airport Road. Dr. Deepak Dubey, HOD and Consultant, Urology, Robotic Surgery and Renal Transplantation, Manipal Hospitals, Old Airport Road. All right, we have our guests, Ms. Rashmi and Ms. Gracie Santosh, who have joined us here today. Everybody, can we also hear it up for them as they've joined us? Thank you, ladies. And yes, not to forget, our chief guests for the day, Ms. Archana Joyce, the Kannada actress from the KGF fame. A big hand for her, please. Thank you. All right, so ladies and gentlemen, so interventional radiology is a medical specialty that performs various minimally invasive procedures using medical imaging guidance such as X-ray fluoroscopy, computer tomography, magnetic resonance image or ultrasound. And interventional radiology performs both diagnostic and therapeutic procedures through very small incisions. Diagnostic interventional radiology procedures are those intended to make a diagnosis or further guidance to medical treatment and includes image-guided biopsy of a tumor, angiography, and cholangiography. And by contrast, therapeutic interventional radiology procedures provide direct treatment, and they include catheter-based medical delivery, medical device placements like stents, angioplasty of narrowed structures, endovascular aneurysm repair, embolization, and IVC filters and dialysis-related interventions. The main benefits of interventional radiology techniques are that they can reach deep structures of the body through a body orifice. That's a tiny incision using small needles and wires. That decreases the risk, pain, and recovery compared to open procedures. Real-time visualization also allows precision guidance to the abnormally, making the procedure more accurate. And yes, ladies and gentlemen, Manipal Hospitals is one of the very few hospitals in Karnataka which has a team of interventional radiologists. And yes, here we are today. And yes, ladies and gentlemen, as we've joined for the Breakthrough Technology of Interventional Radiology by Manipal Hospitals, can we all hear it up with a big round of applause, everybody? And yes, to talk more about this and also to welcome the gathering, we'd like to invite Dr. Manish Rai to please join us on stage, the hospital director, to please join us.
A very good morning to all our dear guests who have joined us today. And it gives me a great pleasure in opening this session. We will have our stalwarts, Dr. Reddy, Dr. Uttappa, and I would also want to make a special mention. Dr. Mala Sibil is here with us, and a round of applause for her. And she is one of the foremost experts in gynae ultrasound. You know, she has published a book which has more than 44,000 downloads, and she's doing exceptional job in this space. I just wanted to make a special mention about her. Thank you so much, Dr. Mala, for joining us. And I guess as we go through this session, we are also very thankful to the two patients, their families, who have consented to join us on this occasion. We will hear in greater detail about what the power, the benefit of interventional radiology is. And for us in Manipal hospitals, it is a matter of huge pride that we are bringing forward a breakthrough technology for the benefit of patients, for the benefit of the wider physician community as well. So please stay tuned in and enjoy the session. Thank you so much.
Thank you, Doctor. We'd now like to invite our chief guest for the day, Ms. Archana Joyce, to highlight the event. Can we please have Archana to join us to highlight the event on Manipal's breakthrough technology, that is interventional radiology. Ladies and gentlemen, let's hear it up with a round of applause, please.
ಎಲ್ರಿಗೂ ಮೊದಲನೇದಾಗಿ ನಮಸ್ಕಾರ. Good morning one and all. First of all, I would like to thank Deccan Herald and Manipal Institution for inviting me today, because of which actually is the main reason, first of all, I got educated about fibroids in fact. And today ಇವತ್ತು ನನ್ನ ಆಡಿಯನ್ಸ್ ಇದನ್ನು ನೋಡೋರು ಪ್ರಾಬಬ್ಲಿ ನನ್ನ ಥರನೇ ಒಬ್ಬ ಕಾಮನ್ ಮೆನ್ ಆಗಿರ್ತಾರೆ. ಹಾಗಾಗಿ ಅವರಿಗೂ ಅರ್ಥ ಆಗೋ ಹಾಗೆ ನಾನೇನು ನೋಡ್ಕೊಂಡು ಬಂದಿದ್ದೀನಿ ಅದೇ ರೀತಿಯಲ್ಲಿ ಹೇಳೋ ಒಂದು ಪ್ರಯತ್ನನ ಪಡ್ತೀನಿ. ಸೊ ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ಇಂಟರ್ವೆನ್ಷನಲ್ ರೇಡಿಯಾಲಜಿ ಅನ್ನೋದನ್ನು ಇಂಟ್ರಡ್ಯೂಸ್ ಮಾಡಿದ್ದಕ್ಕೆ ಐ ವುಡ್ ಲೈಕ್ ಟು ಕಂಗ್ರ್ಯಾಚುಲೇಟ್ ಆ್ಯಂಡ್ ಥ್ಯಾಂಕ್ ಮಣಿಪಾಲ್ ಹಾಸ್ಪಿಟಲ್ಸ್. ಬಿಕಾಸ್ ಯುಟರಸ್ ಅನ್ನೋದು ಒಬ್ಬ ಮಹಿಳೆಗೆ ತುಂಬ ಅತಿ ಮುಖ್ಯವಾದ ಒಂದು ಆರ್ಗನ್ ಆಗಿರುತ್ತೆ, ಆ್ಯಸ್ ವಿ ಆಲ್ ನೋ. ಇದರಲ್ಲಿ ಕಾಣುವಂಥ ಒಂದು ಟ್ಯೂಮರ್ ವಿಚ್ ಇಸ್ ನಾನ್ ಕ್ಯಾನ್ಸರಸ್ ಫೈಬ್ರಾಯ್ಡ್ಸ್ ಆಗಿರುತ್ತೆ. ಇದು ನಾವು ಯೂಶ್ವಲಿ ಅಂದ್ಕೊಳ್ತೀವಿ ಫೈಬ್ರಾಯ್ಡ್ಸ್ ಅಂತಂದರೆ ಗಾತ್ರ ಹೆಚ್ಚಿರುತ್ತೆ, ಇದನ್ನು ಸರ್ಜರಿ ಮಾಡಿ ರಿಮೂವ್ ಮಾಡಬೇಕು ಅಂತ. ಬಟ್ ಈ ಒಂದು ಟೆಕ್ನಾಲಜಿಯಿಂದ ಇದು ಯಾವುದೇ ರೀತಿಯ ಒಂದು ತೊಂದರೆ ಇಲ್ಲದೆ ತುಂಬ ಸುಲಭವಾಗಿ ಟ್ರೀಟ್ಮೆಂಟ್ನ ಪಡೆಯುವಂಥ ಒಂದು ಇಂಟರ್ವೆನ್ಷನಲ್ ರೇಡಿಯಾಲಜಿ ಒಂದು ಟ್ರೀಟ್ಮೆಂಟ್ ಆಗಿರುತ್ತೆ. ಆ್ಯಂಡ್ sorry I think like everybody knows fibroids ಅನ್ನೋಂಥದ್ದು ಅದರ ಸಿಂಪ್ಟಮ್ಸ್ ಸುಮಾರಷ್ಟು ಜನಕ್ಕೆ ಗೊತ್ತಿರತ್ತೆ. ಗೊತ್ತಿಲ್ಲದೆ ಇರೋರಿಗೆ ಮೆನ್ಸ್ಟ್ರುವಲ್ ಸೈಕಲಲ್ಲಿ ಆಗುವಂಥ ಏರುಪೇರುಗಳು, ಇರ್ರೆಗ್ಯುಲರ್ ಪೀರಿಯಡ್ಸ್ ಆಗಿರಬಹುದು, ಅಥವಾ ಒಂದು ತಿಂಗಳಿನಲ್ಲಿ ಒಂದು ಸೈಕಲಲ್ಲಿ ಒಂದು ಸಲ ಆಗುವಂಥದ್ದು ಮಲ್ಟಿಪಲ್ ಟೈಮ್ಸ್ ಆಗುವಂಥದ್ದು, ಅಥವಾ ಪ್ರೊಲಾಂಗ್ಡ್ ಪೀರಿಯಡ್ಸ್ 5 ದಿವಸಕ್ಕೆ ನಿಲ್ಲುವಂಥದ್ದು, ಎಲಾಂಗೇಟೆಡ್ ಆಗಿ ಪ್ರೊಲಾಂಗ್ ಆಗುವಂಥದ್ದು, ಇವೆಲ್ಲನೂ ಒಂದು ಸಿಂಪ್ಟಮ್ಸ್ ಆಗಿರುತ್ತೆ. ಈ ಸಿಂಪ್ಟಮ್ಸನ್ನು ಮೊದಲೇ ದೇಹ ನಮಗೆ ಅದನ್ನು ತೋರಿಸೋದ್ರಿಂದ ಆದಷ್ಟು ಬೇಗ ಇಟ್ಸ್ ಬೆಟರ್ ಯು ಕನ್ಸಲ್ಟ್ ಅ ಡಾಕ್ಟರ್ ಆ್ಯಂಡ್ ಗೆಟ್ ಇಟ್ ಟ್ರೀಟೆಡ್. ಆ್ಯಂಡ್ ಮೋಸ್ಟ್ ಆಫ್ ದ ಟೈಮ್ಸ್ ಇಟ್ ಇಸ್ ಆ್ಯಕ್ಚುಲಿ ಎಸಿಂಪ್ಟಮ್ಯಾಟಿಕ್ ಆ್ಯಂಡ್ ಅದಷ್ಟು ಹಾರ್ಮ್ ಕೂಡ ಮಾಡೋದಿಲ್ಲ. ಬಟ್ ಮೇಜರ್ ಆಗಿ ಈ ಥರ ಆದಾಗ ಇಟ್ ಇಸ್ ಡೆಫಿನೆಟ್ಲಿ like the uterine fibroid, in the name itself it suggests it affects the uterus and pregnancy problems ಆಗೋದು, ಕನ್ಸೀವ್ ಆಗೋದಕ್ಕೆ ತೊಂದರೆ ಆಗುವಂಥದ್ದು, ಕನ್ಸೀವ್ ಆದ್ರೂ ಅಬಾರ್ಷನ್ಸ್ ಚಾನ್ಸಸ್ ಜಾಸ್ತಿ ಇರುತ್ತೆ. ಹೀಗೆಲ್ಲ ಆಗೋದ್ರಿಂದ ಆ್ಯಂಡ್ ಇದು ಒಂದು ಬೂನ್ ಅಂತ ಹೇಳ್ಬೋದು. ಯಾವುದೇ ರೀತಿಯ ಒಂದು ಓಪನ್ ಸರ್ಜರಿ ಆಗಲಿ ಅಥವಾ ಇದು ಯಾವುದು ಇಲ್ದೇ ತುಂಬ ಈಸಿಯಾಗಿ ನಡೆಯುವಂತಹ ಒಂದು ಪ್ರೋಸೆಸ್ ಆಗಿರುತ್ತೆ. ಬಟ್ ಇದಕ್ಕೆ ಒಂದು ರೂಟ್ ಕಾಸ್ ಅಂತ ಹೇಳೋದಾದರೆ, ಆ್ಯಸ್ ಫಾರ್ as I know, I'm not sure because I am not the subject matter of expert. ಅವರೆಲ್ಲ ಇಲ್ಲಿದ್ದಾರೆ SME ಅವರು. ಹಾಗಾಗಿ as far as I know they say ಇದೇ ಖಚಿತವಾದ ಕಾರಣ ಅಂತ ಹೇಳೋದಕ್ಕಾಗದೇ ಇದ್ರು there are multiple possibilities for the formation of fibroids. Majorly it can be genetical, it can be because of hormonal imbalance, ಈ ರೀತಿಯ ಕಾರಣಗಳಿಂದ ಆಗಿರುತ್ತೆ. ಆ್ಯಂಡ್ ಮೇಜರ್ಲಿ ಲೈಫ್ ಸ್ಟೈಲ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಅಂದರೆ ಅಗೇನ್ ಇಟ್ ಇಸ್ ಆಲ್ ಇಂಟರ್ ರಿಲೇಟೆಡ್. ಹಾರ್ಮೋನಲ್ ಇಂಬ್ಯಾಲೆನ್ಸ್ ಆಗೋದು, ಲೈಫ್ ಸ್ಟೈಲಿಂದನೇ ಇಂಬ್ಯಾಲೆನ್ಸ್ ಆಗುವಂಥ ಸಾಧ್ಯತೆಗಳಿವೆ. ಫುಡ್ ಇಂಟೇಕ್, ನಾವು ಯಾವ ರೀತಿಯ, ಆ್ಯಂಡ್ ಐ ಥಿಂಕ್ ಇಟ್ ಇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಟು ಬಿ ಮೈಂಡ್ಫುಲ್ ನಮ್ಮ ಲೈಫ್ ಸ್ಟೈಲಲ್ಲಿ. ಆ್ಯಂಡ್ ಇಟ್ ಈಸ್ ಆಲ್ಸೋ ಇಂಪಾರ್ಟೆಂಟ್ ಟು ಹ್ಯಾವ್ ಅ ರುಟೀನ್. ನಾವು ಎಷ್ಟೊತ್ತಿಗೆ ಹೇಳ್ತೀವಿ, ಏನು ವ್ಯಾಯಾಮ ಮಾಡ್ತಿದ್ದೀವ, ಊಟ ಏನು ಮಾಡ್ತಾಯಿದ್ದೀವಿ, ಎಷ್ಟು ತಿಂತಿದ್ದೀವಿ, ಎಷ್ಟು ನ್ಯೂಟ್ರಿಷನ್ಸ್ನ ನಾವು ಇಂಟೇಕ್ ಮಾಡ್ತಿದ್ದೀವಿ, ಇದು ಎಲ್ಲದನ್ನು ಗಮನಿಸೋದು ತುಂಬ ಮುಖ್ಯ ಅಂತ ಅನಿಸುತ್ತೆ. ಹಾಗೆ ನೋಡಿಕೊಂಡಾಗ ಬಹುಶಃ ನಾವು ಡಾಕ್ಟರ್ಸ್ ತನಕ ಬರೋ ಅವಶ್ಯಕತೆಯೂ ಇರೋದಿಲ್ಲ. ಬಟ್ ಲೈಕ್ ದೇ ಸೇ ಪ್ರಿವೆನ್ಷನ್ ಇಸ್ ಆಲ್ವೇಸ್ ಬೆಟರ್ ದೆನ್ ಕ್ಯೂರ್. ಪ್ರಿವೆನ್ಷನ್ ಯಾವತ್ತೂ ನಮ್ಮ ಕೈಯಲ್ಲಿದೆ. ಕ್ಯೂರ್ ಇವಾಗ ಇವರು ಆಲ್ರೆಡಿ ತೊಗೊಂಡು ಬಂದಿದ್ದಾರೆ, ಸೊ ವಿ ಡೋಂಟ್ ಹ್ಯಾವ್ ಟು ವರಿ. ಸೊ ಪ್ರಿವೆನ್ಷನ್ ಅಂದರೆ ನಾನು ಹೇಳ್ದಂಗೆ ಲೈಫ್ ಸ್ಟೈಲಲ್ಲಿ ಸಣ್ಣ ಸಣ್ಣ ಬದಲಾವಣೆಗಳು, ಆ್ಯಂಡ್ ಆಲ್ಸೋ ಐ ಫೀಲ್ ಸಸ್ಟೈನಬಲ್ ಲೈಫ್ ಸ್ಟೈಲ್ನ ಮೇಂಟೈನ್ ಮಾಡೋದ್ರಿಂದನೂ ಸಾಕಷ್ಟು ನಮ್ಮ ಹೆಲ್ತ್ ಇಶ್ಯೂಸ್ನ ನಾವು ಅವಾಯ್ಡ್ ಮಾಡ್ಬೋದು ಅನ್ನೋದು ನನ್ನ ಅನಿಸಿಕೆ. ಸೊ ದಿಸ್ ಇಸ್ ಆಲ್ ಐ ವಾಂಟೆಡ್ ಟು ಸೇ. ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ಒನ್ಸ್ ಅಗೇನ್ ಡೆಕ್ಕನ್ ಹೆರಲ್ಡ್ ಆ್ಯಂಡ್ Manipal Hospital for having me here today. Thank you so much. Have a great day.
Thank you, Archana. That was well said. Everybody, can we hear it up with a round of applause for Archana, please, everyone? Thank you. All right, so ladies and gentlemen, it's time for our first panel discussion of the day. And yes, this discussion is regarding uterine fibroids, which just Archana spoke about, and the symptoms, management options, and including embolization. And yes, to know more about this, firstly, we have a video from a patient, Ms. Rashmi. So can we please have the video up?
I'm Rashmi. I'm a 46-year-old child-free cisgender woman living in Bangalore. My life is divided between 2020, that is pre-2020, and post-2020. So pre-2020, I was a photographer. I made films, I documented movements, I taught photography, and I taught art. I traveled a lot. In 2020, when the lockdown happened, I started to experience a lot of pain in my back. This was extraordinarily painful. It disabled me. I couldn't travel. I couldn't get into an auto. Sometimes even walking on the road, if there was a pebble or something, then I would go into spasms. So I was like, okay, let me just get it checked. Now I met a rheumatologist because I said, okay, this is chronic pain. I've had investigations before. I've had x-rays done. I've met doctors. And there was nothing that was diagnosed. Thankfully, I had a rheumatologist who decided to investigate further, ordered an MRI, and there was this really big fibroid. So it was about 7 centimeter into 8 centimeter. And I was also diagnosed at the same consultation with spondyloarthritis.
Ms. Rashmi presented to us last year when she was 45-year-old with history of painful periods, low back pain, urinary incontinence. All these symptoms were affecting her quality of life. This also included mood swings occasionally. We explained to her with regard to the procedure of uterine artery embolization, what she would have to go through, how simple the procedure is.
And meeting with Dr. Reddy Prasad, I think it was really comforting to be able to have that conversation. I was not just like, I was not a diagnosis and a solution, you know. I was something more than that, you know. So with interventional radiology itself, to kind of look at what was my quality of life, how could Dr. Reddy Prasad's intervention through this procedure change and improve the quality of my life. So I think kind of going through that was really nice.
We gave her time to decide which procedure she wanted, because there are several options in the management of fibroids. One is medical treatment with hormonal therapy. The other one is surgery, which could be myomectomy or hysterectomy. And minimally invasive option, uterine artery embolization.
Our family has been with Manipal hospitals for the past 2 decades. My dad was treated here, my mom was treated here. And there's a certain level of trust that is already inbuilt in the relationship I share with the hospitals. And I know it, so there's a certain comfort. So I was really happy to know that they were offering uterine fibroid embolization. I went back, I spent about 2 weeks researching on the procedure. I sat through loads of YouTube videos by doctors, as well as there are a lot of patient testimonies about going through the whole process. So I kind of like knew that this was okay, that this was something that I could deal with and do. So I came back and scheduled it and went through it.
She went through the procedure very smoothly. This is a pinhole procedure. The procedure is performed just through a 2 to 3 millimeter incision. There is no blood loss, there is no scarring, and usually patients are discharged the very next day after the procedure. This procedure is performed under sedation.
Once I went back home, I think the pain kind of reduced, but I developed a complication. I had a gut infection. So then I had to come back into hospital. So my recovery took a little longer than would be expected.
1 year following the procedure, all her symptoms had dramatically improved. Equally importantly, on the MRI scan, there was complete infarction of the fibroids, and there was reduction in the size of both the fibroids and thereby the volume of the uterus.
Within a month, I was back on my feet. Within 2 months, it was as if, this whole, it was a huge chunk of pain and disability that had been erased.
As Ms. Rashmi mentioned in her own words, the hospital stay is very less, and there is less risk of infection, and there is quicker resumption to work.
Within 2 months, I was back. I was able to walk. I was able to take an auto. I was able to do work. I had so much of energy. And it just felt like I felt light. And that was so amazing.
My message to women with fibroids is, you discuss with your gynecologists if you would be suitable for uterine artery embolization, and then make an informed choice about the procedure that you would want to go for.
All right, so ladies and gentlemen, that was the story of Ms. Rashmi. And yes, don't you all think this is definitely a breakthrough technology? Yes, no? Yes, absolutely, yeah. All right, so ladies and gentlemen, so we see how she went through all the painful phase to now feeling very light. Yes, and also to know more about this, we would like to welcome Dr. Reddy Prasad Yadavalli, the HOD and Consultant, Interventional Radiology, Manipal Hospitals, Old Airport Road. Ladies and gentlemen, let's hear it up with a big round of applause, please. Dr. Reddy Prasad will be the moderator for the session. And can we have Dr. Gayatri Karthik, HOD and Consultant, Obstetrics and Gynecology, Manipal Hospitals, Old Airport Road. Dr. Rajesh Venkatesh Helavar, Consultant, Interventional Radiology, Manipal Hospitals, Hebal. Welcome, doctors. Please be seated. And now, ladies and gentlemen, we just now saw the video, and it's a very inspirational one to all the ladies out there who are going through this pain. And yes, we have Rashmi here as well with us. With a big, big round of applause, ladies and gentlemen, let's welcome Rashmi on stage. Thank you for joining us. Dr. Reddy, over to you now.
Thank you so much. Good morning, everyone. Thank you all for coming on a busy Monday morning. Thanks to Deccan Herald, our Manipal management, Ms. Adams, Ms. Archana Joyce, and particularly Dr. Bhavana and her team. Thank you so much. And we have a very interesting session and discussion. This panel consists of Dr. Gayatri Karthik, HOD, Obstetrics and Gynecology at Manipal Hospitals, Old Airport Road. Dr. Rajesh Helavar, Consultant Interventional Radiologist at Manipal Hospitals, Yeshwantpur and Hebal. And Ms. Rashmi, who is a professional photographer. And myself, Dr. Reddy Prasad, HOD and Consultant Interventional Radiologist at Manipal Hospitals, Old Airport Road. The stage has already been set with the discussion, with the introduction, and I was impressed with the wide knowledge of Dr. Ms. Archana Joyce with regard to fibroids. And that's what really we are aiming for. We want to promote the awareness of existence of fibroids and all the details, what the management includes. Now, I would like to start off the discussion this morning with Ms. Rashmi. Kindly, would you take us through what symptoms you had? Obviously, we have seen the video, but for the benefit of the viewers online, what you presented with, what was bothering you?
Okay, so the immediate reason why I ended up going to the hospital was because I had severe back spasms. So it was really difficult to even walk or lie down or sit down. So I didn't know what was triggering it. And I had had investigations done before with nothing found. I mean, the doctor was investigating, didn't find anything. And so I ended up at rheumatology. So because it was the back, and there was, with the MRI, it was an incidental finding that happened with the fibroids. And it was a radiologist who insisted that I address it. So when I saw the fibroids, and I was like, okay, this might be the reason why the spasms were happening. And it was because it's not a very classical symptom, the backache. And I've had backache for like nearly a decade. But simultaneously, I also have spondyloarthritis, so it became a little difficult in terms of the symptoms. I also had very painful periods, extremely debilitating pain, but didn't link it up to fibroids. And, period pain is people are very dismissive about it. So even I didn't take it very seriously, even though it was painful. So that was my symptoms.
Thank you for that, Ms. Rashmi. Uterine fibroids are very, very common. Up to 50% of women during their reproductive age group might have symptomatic fibroids. I'll request Dr. Gayatri Karthik to educate us about the prevalence of fibroids in the society and what a burden it is to the women, and what are the most common symptoms that a woman might present with.
Like you said, at least half the women in society can have fibroids. But what is classic about the fibroids is there is no particular symptomatology. It can vary from absolutely asymptomatic fibroids to basically they cause symptoms in terms of having period issues or difficulty in conception or abortions or postmenopausal bleeding. So the range is wide. So how we decide on treatment is basically depends on the size, the site, and the symptoms. And so the symptoms basically depend on whether they're causing pressure symptoms, like in Mrs. Rashmi's case, that she had back pain. People could also have, if it was located in towards the bladder, they could have I think she also did mention some bladder incontinence or a frequency or a feeling that they have not completely emptied the bladder. If the fibroids are located towards the inside, the cavity, they can have severe pains during periods, they can have spotting between periods, and difficulty in conception, repeated abortions. So if it is on the outside, they may not have symptoms at all, and they just keep growing, and they think they are only adding weight.
Thank you so much for that. And now we know that the fibroids being very, very common problem for women during the reproductive age group, they could not necessarily go to a gynecologist. They could go to a urologist with urinary incontinence, not knowing what is the problem. They could go to a spine surgeon or a rheumatologist with their low back ache. They could even go to a psychiatrist or a general practitioner because they're not really feeling all right. They feel they have low mood, nothing is working, that kind of a situation. Thankfully, once the patient comes to the gynecologist, they're thoroughly assessed. What are the first few investigations that you take them through with regard to diagnosis of fibroids?
So the first investigation would naturally be an ultrasound to locate where exactly they are located and whether it is the cause for the symptoms. Like I said, if they are asymptomatic, then we know the symptoms, we'll have to find another cause. So the ultrasound gives us the cause, and then we naturally evaluate how much blood loss is happening, and so we do a routine blood count. So basically, these two then helps us decide what we need to do further.
My next question is to Dr. Rajesh. So once a diagnosis by the gynecologist is made, obviously they would have given them the option of surgical versus uterine artery embolization and medical management initially. By the time they come to an interventional radiologist, they would have gone through the medical management, and then they want more information about what this procedure is. Unfortunately, the awareness of uterine embolization for fibroids is very, very, very poor amongst the public, amongst the general practitioners. And this is one of the sessions of the many more that are going to come from Manipal. Next month is, July is Fibroid Awareness Month throughout the world. You can see why we are doing more sessions like this. My question to you, Dr. Rajesh, is initial investigations as an interventional radiologist, what are your thoughts?
After the initial assessment and investigations by our gynecology colleagues, we would like to get an MRI of the abdomen and pelvis with contrast, a urine culture, and a pap smear. Most important of them is the MRI that we do. MRI is done to look at the number of fibroids, the position of the fibroids, are they projecting inside or are they projecting outside, and what is the kind of mass effect they are having. And also, it helps us in selecting people who will benefit from the procedure per se. For example, if the lesion is, fibroid is enhancing intensely, they're taking up a lot of contrast, it indicates that it's going to give a lot of relief to the patient. So, just recap, we do an MRI, urine culture, and a pap smear before taking up the patient further.
Once a diagnosis of uterine fibroids has been made and other exclusions have been made, and the patient, should they choose to have a uterine artery embolization, what would you discuss with the patient? How would you educate them? And can you educate us all with regard to the minimally invasive option, which is uterine artery embolization? Still, the awareness is very poor. You'll be surprised that the first procedure was performed in 1994 in Paris. Can you please educate us about the procedure?
Okay. A typical procedure is where a patient comes in the morning and gets admitted to the wards, and from there she's obviously she's got her blood tests and investigations before. From there she goes to the cath lab. It's a laboratory where we do the procedure, and a small nick is made about 2 to 3 millimeters in the groin, size of a pinhole, and through that a tube called a catheter is placed into the artery supplying the pelvis and the uterus. And we identify the arteries that supply the fibroid, and we deliver particles called as PVA particles, which are ranges from 300 to 500 microns in size. And through a selective catheter, we deliver these particles which block the blood supply to the fibroid. And the average time for this procedure is about between 30 minutes to 90 minutes. And during the procedure, the patient also receives painkillers and to reduce the pain during and after the procedure. And there is no cut or any suture done. And post this, patient is observed in the observation area for a couple of hours. And if any additional pain medication is required, is given, and if any supportive therapy is given. And typically on day 2, the patient goes home, and the patient can start walking at about 2 to 4 hours from the procedure. Patient can start walking and resume her activities within the hospital itself. So she'll not be in the bed for a very long time. So typically by day 2, she should go home.
Thank you very much. Ms. Rashmi, could you please take us through your journey, how you went through the procedure, and what was your feeling all over about the procedure overall?
Like doctor said, I got admitted and it was scheduled for the afternoon. I was out by about 5 o'clock, and I think I was in pain. I know there have been different, people react differently. Some people don't feel any pain and some people feel pain. By around 9 o'clock, it had come down. My pain levels had reduced drastically. And what was surprising is by next morning, because I had had bladder issues before, by next morning I suddenly realized that the pressure was completely off my bladder. And it was like, it was instantaneous. And I hadn't realized how I had been living with that bladder issue, with the pressure on it. And I was discharged the next day. It took me about a week or so to kind of like regain my energy and, my levels and all that. Yeah.
Thank you. And now I'll request Dr. Gayatri Karthik to educate us about the minimally invasive options in the management of fibroids as a gynecologist?
So when a patient comes to us with fibroids, we decide on management based on, like I said, the site, size, and symptoms. Now, a fibroid may be small, but if it is causing infertility and blocking the tubes, then it needs to go out. Or if it's causing pressure changes, pressing on the tubes that come down from the kidneys, then we need to address it. So the symptoms, if a fibroid is, say, about 2 or 3 centimeters, not causing any symptoms, we could just leave them alone and watch. So the management options we offer them are medical treatment. There are medications that are available for shrinking fibroids. But then these have to be used only in some selected patients. So that decision is usually made by the gynecologist depending on all these factors. Surgical treatment will depend on a patient's desire to retain fertility and desire to retain the uterus. So sometimes the fibroids are very large and they're very symptomatic, and patients do not want to retain the uterus, and if they are at an age when they can do away with the uterus, then we would recommend a hysterectomy. The modes for removing only the fibroids, which we call as myomectomy or hysterectomy, we can do minimally invasive. So if a fibroid is completely within the cavity of the uterus, we do a hysteroscopy. We put a camera into the uterus and see where the fibroid is and nibble it away so that the patient has relief. But if it is in the wall of the uterus, we can do a laparoscopic or a robotic myomectomy. These are minimally invasive procedures. We admit the patient, operate, and the very next day they go home. Some degree of minimal discomfort at the sites. The wound sites are only about 5 to 8 millimeters, so the patients are quite comfortable, and they resume their routine work in a week to 10 days time. So these are the options. Robotic myomectomy is picking on, patients are extremely comfortable, but these are all the different options. So the patient has to discuss, and between the doctor and the patient, a decision has to be made.
That's a wonderful statement that you're making. The patient has to be educated well enough, and the patient has to be really empowered to make an informed choice as to what they really want to have, the treatment option. Because the beauty is that even in gynecology, there are so many advances. Robotic myomectomy is a great advance, and it is also breakthrough technology. We at Manipal hospitals, all under one roof, have the experts, and we have all the options available. And we would give these options to the patient. At the end of the day, we have educated them, and they choose what they want. But our job is to educate them. Moving on to the next question, I would like to again request Dr. Gayatri Karthik. All these minimally invasive options and breakthrough technology is at saving the uterus. We don't want the patients to have unnecessary hysterectomies. So what are your thoughts on how do we promote this awareness and making sure that we educate more people about these options available in our hospitals?
It's very important. In fact, the Federation of Obstetrics and Gynecological Societies of India have launched a Save the Uterus campaign. We are educating. The very next month is the month of fibroids, and we are planning to create more awareness programs to educate people, the general practitioners, and in fact even gynecologists, that not all surgeries, not all fibroids require surgeries, and we have options available which can be used and used effectively.
Thank you so much. And Dr. Rajesh, what are your thoughts on this minimally invasive procedure and also saving the uterus? That is where we obviously significantly add to the gynecology team.
So about save the uterus, a uterus is, a woman is emotionally, psychologically, physically, and sexually tied to her uterus. So I think Save the Uterus is a very important campaign. I think, as you already mentioned, July is the month for Save the Uterus campaign. And we've already spoken about the minimally invasive technology that almost pain-free and no scar, and which is afforded, given by the uterine artery embolization procedure.
Ms. Rashmi, could you please tell us, now that you've had a uterus sparing or uterus saving procedure, overall, how do you feel?
The uterus is no longer an issue. I think all my life I was like, oh God, why the hell did I have this? Like every single period was like such a painful period. The first period I had after the embolization was my first pain-free period. And I've had pain-free periods after that. It is just, I mean, to have had to suffer that, I think that's the tragedy of it. I think the education is also with general physicians, because it's not necessary that I go to a gynecologist. So if I go and, if just incidentally, I would say I have painful periods. But, to kind of say, okay, I think it's important to kind of look at that. And other than that, I was anemic for about 10 years. My hemoglobin's finally up. I do not have chronic fatigue. And I don't have to deal with menopause. That was one of the reasons that I decided I did not want a sudden menopause. I did not want hysterectomy. I wanted time, like how our bodies prepare us. I wanted that time to be able to prepare for menopause. So I've gotten that time now. And so I don't have to deal with that. So this is one less of an issue. So I have more energy and more time to devote to like dealing with my like spondyloarthritis, So I think it's been like, for me, it's like the most wonderful thing I did, the choice, yeah.
That's,
Comment?
please.
I'd just like to point out, for the sake of educating the public, that though we define menopause as the cessation of periods, a hysterectomy removes the uterus, but the hormones that go into the medical definition of menopause are produced by the ovaries. And so you will not undergo menopausal changes after a hysterectomy alone. Unless the ovaries are removed, you will not have changes pertaining to menopause coming in.
That's a very useful point, Dr. Gayatri Karthik. What we really want is someone who comes to the hospital, a super specialty quaternary center like Manipal hospitals, where we have all under one roof, and we want you to go back with a smile, which is what you just did. And that smile is as a result of combined team effort by all our super specialists. I'm taking this opportunity to very briefly mention what is interventional radiology. It is a super specialty that is recognized throughout the world. In Manipal hospitals, we have the world experts. I take pride in saying that a group of our 4 consultants in interventional radiology and the team who work, the specialists and fellows and the nurses, everyone who work tirelessly to bring out these successful outcomes. It's very important. We have that at Manipal. And very important, with the help of our gynecology colleagues, particularly our HOD, we are in the process of setting up dedicated fibroid clinic in Manipal Hospital, where the patients are given all options. It is widely available. So I would like to thank everyone, and I would like to request Dr. Gayatri Karthik to make her closing statements.
So if you have fibroids, do not worry. See Rashmi. Please go through your discussions with your gynecologist. Discuss what it is that you want and what is advisable for you, and make the right decisions. And have a happy uterus and save your uterus whenever possible.
Dr. Rajesh, your closing statement, please.
So many minimally invasive technologies, both gynecologic and interventional radiology methods, are available to save the uterus and attain a normal life, pain-free life, like Ms. Rashmi said. So many women after the embolization feel that they have been burdened for so many years, and their first period, when they have their first normal period in years, they'll be happy, and both minimally invasive procedures can provide this. So see your specialist if you have any fibroids. Thank you.
Thank you. Ms. Rashmi, your message to the wider audience and general public, please.
And a beautiful smile that goes with it.
Yeah, I think at the end of the day, I think what has been stressed here is that the patient needs to be well informed, and the patient makes the choice depending on what they want in their lives. And I have no regrets with what I've done. I am really glad that that is a chapter that I can close, thankful, touch wood, and move on with life. So, yeah.
Thank you. I would like to thank Deccan Herald, Manipal Hospital Management, our interventional radiology team who work really hard, and our gynecology colleagues, and really and truly the patients who have their trust in us. Thank you so much. We close this session now.
Rashmi, you can join too for a group picture, please.
Once a lady is diagnosed with fibroids, which is what is the topic now, the cheapest option that is available is medical management. Dr. Gayatri takes care of all that. If that doesn't work, it's not a long-lasting solution, 3 months, 6 months, then the options that we are discussing are all pretty much similar costs. So there's nothing to worry about. And the other thing which I always mention is when in France and Europe, in the journals that are published, economic models have been done by the patient going through this minimally invasive or even apparently slightly costlier procedures initially. If you compare to someone going through a hysterectomy in a nursing home, they're quicker to work. They start earning, and their quality of life is much better. They don't have a huge scar. All these benefits are unseen, unaccounted, but they also add to the economics. Thank you.
Thank you, doctors. Well, ladies and gentlemen, we've seen that at least about 50% of women have fibroids, and about 50% of them, half of them, are asymptomatic. And yes, now most of us do not know what it is, and we do not know about the procedures. So yes, we've had a wonderful sessions with the doctors telling us what are the symptoms that we can actually look for, what are the symptoms that you can, so there are different symptoms which may not relate to this at all. And yes, thank you so much for having a wonderful session this morning. Everybody, a big round of applause. And yes, the doctors also explained us about the initial interventional diagnosis and post the procedure as well, how the procedure goes on as well. And yes, the coming month is the month of fibroids. And yes, ladies and gentlemen, Save the Uterus is such a nice campaign, and Manipal Hospitals is working really hard towards it. And can we hear it up with a big round of applause for Manipal Hospitals for this, everyone? Thank you. And now we're moving on to our next session, our next panel discussion for the day. And yes, the discussion is regarding renal angiomyolipoma, diagnosis, clinical presentation investigations, management options, and discussions regarding embolization. So now, to know more about this, firstly, let's have a video. So we have a video with Ms. Gracie. So can we have the video up, please?
Hi, my name is Gracie. I'm 46-year-old from Bangalore. I was going for a routine checkup and I came to know there was a tumor growing in my kidney. Tumor was found in 2018, first when we did. So after that, after 1 year again we went to the doctor. So doctor told it is already grown to 3.5 centimeters. So it is not safe to wait. So we went to other hospital. There the doctor told we have to do a surgery, or there is another option, it is angioembolization. So that was not available in their hospital. So we had to call other hospitals where this surgery was available. So we called up Manipal Hospital. There we came to know there this procedure is done. So we went to Manipal and consulted Dr. Dubey. This procedure is, they'll block the tube. So block the blood flow which is going to the tumor. So he referred us to radiologist Dr. Reddy Prasad.
Once she presented to me, we performed a CT scan, confirmed the diagnosis of renal angiomyolipoma, and we advised that she would undergo an embolization procedure.
He told us about the procedure, what and how it is. So first time I came to know about this embolization procedure. Doctor told it is safe, there's nothing to worry. Then we thought we'll take a chance on this because it's a new thing and I wanted to try.
The traditional alternative for embolization is surgery, where she would lose a portion of the kidney, and which means she will have to go through a partial nephrectomy, and this is a relatively major procedure. However, with interventional radiology and with the technical advances in our specialty, we were able to perform an embolization procedure. This is a minimally invasive procedure which is performed through a very tiny 2 to 3 millimeter incision under local anesthesia. A catheter, which is a fine tube, is taken selectively into the left kidney blood vessels. An angiogram is performed, and a super selective catheterization of the blood vessels that are supplying the angiomyolipoma is performed, and this is usually blocked with some particles. However, in this lady, a special technique had to be applied, and we embolized this with some coils. Following the procedure, the patient performed very well. She was discharged the very next day and her recovery was very quick.
After the procedure, I was shifted to the ward. There, next day, Dr. Reddy Prasad came to see me, and I was like all excited to know that there's no scar, and everything was done so smoothly.
1.5 years down the line, the follow-up scans show complete resolution of the angiomyolipoma, and Mrs. Gracie Santosh is doing extremely well.
After 2 years, this is my testimony of my procedure. I thank Dr. Deepak Dubey, who sent me to Dr. Reddy Prasad, who did a wonderful job. His team was there. They took care of me very well, and it was all because of Dr. Reddy Prasad. I can tell it is done very nicely.
All right, so ladies and gentlemen, that smile on Miss Gracie's face says it all. I think she's really happy about the procedure, how the procedure has gone on. After 2 years, she's fully recovered and with no scar at all. And yes, ladies and gentlemen, this is also without having to lose any part of your organ as well. So this is again saving the organ. And yes, Manipal Hospital is doing a great job once again. And for this session, we'd like to call on stage Dr. M.C. Uttappa, the Cluster Head, Interventional Radiology, Manipal Hospitals, Bangalore. Everybody with a huge round of applause, please. Dr. Uttappa will also be the moderator for this session. Up next, we'd like to invite on stage Dr. Deepak Dubey, HOD and Consultant, Urology, Robotic Surgery and Renal Transplantation, Manipal Hospitals, Airport Road. Dr. Nagabhushan, KN Consultant, Interventional Radiology, Manipal Hospitals, Whitefield. Everybody with a round of applause, please. And now we just saw the video of Miss Gracie. We have Miss Gracie here with us. Can we all hear it out with a big round of applause? And let's welcome Gracie on stage. Dr. Uttappa, over to you now.
Thank you very much. Once again, sort of good afternoon to everyone who have signed up to this session. And once again, I would like to repeat what Dr. Reddy has said, that it's a Monday morning, and a huge thank you to the entire team of Manipal. Big thank you to our clinical colleagues, particularly Dr. Deepak Dubey, who's made time out to be here with us, because his insights are very important for today's session. Thank you to our interventional radiology team. We're all here. I'm sure a lot of work pending when we get back, but we'll get to that. Last but not the least, Gracie, thank you for being today with us, and we'd like to listen more from you. So I think continuing the theme of minimally invasive and maximally effective, I hope that this session will kind of consolidate that message which has already been done in the last half an hour. I think the theme is also saving organs. I hope we'll convince on that aspect as well. So I'm going to start off the session. Really, it's focusing on what is called as AML, which is angiomyolipoma of the kidneys. And like the uterus is very important, so are the kidneys. So I think we'll get started just to sort of briefly introduce Dr. Deepak as to what is an AML and kind of how does it present?
Thank you, Dr. Uttappa. So AML is angiomyolipoma. These are tumors which can occur in various organs. Most commonly, they occur in the kidney, on the surface of the kidney. So they can be incidental. Most of the times they are incidental. That is, they don't present themselves with any symptoms, but they are picked up on an ultrasound which the patient may have had done for some other reason. So most AMLs or angiomyolipomas are incidental. Sometimes they can present very dramatically as an emergency because they will rupture on the surface of the kidney and they'll bleed extensively. And that can be quite catastrophic because at that point of time, the patient has to rush to the hospital and be treated in emergency, and it can be life-threatening. So it can also occur as a part of some genetic syndromes, which is rare. Most of the times, the AMLs are non-genetic. So most common way of presenting is incidental. Occasionally, they may present with some discomfort, and rarely as an emergency.
Thank you, Dr. Deepak. I think, just the fact that it's incidental, I think can come as a shock to patients when they come to know about it. So, yes, you probably just want to just hear from you as to when you first were told, what was the initial reaction? How did you sort of handle that news being shared with you? Were there any fear, anxiety, concerns? We'd like to know more from you because I'm assuming that you didn't have any symptoms, but if you had any, please share those as well.
Okay, thank you, doctor. First, when I came to know about this, I was really shocked. I thought it must be a cancer. First of all, when you think of a tumor, it goes to mind that it's a cancer. Then I came to know it is non-cancerous. I just went for the routine checkup. So in kidney, in ultrasound, they found the kidney growth of a tumor. So then we went to the doctors. Their doctor told to do an CT scan. So in CT scan, we found the tumor was grown to 2.5 centimeters 4 years back in 2018. So then we didn't know what to do. So then we went to another doctor. There the doctor told up to 4.5 centimeters you can wait and see. Otherwise, you can do a surgery now also. So we didn't want to take a chance. We thought we'll wait and see for 1 year. If it is reducing, so we thought no need of going for a surgery. We waited. After a year, again we did a CT scan where we found that was grown to 3.5 centimeters. So it was growing. So then again we were tensed what to do now. Then we went to a hospital there. They told we can do surgery or embolisation. So we didn't know what it is. Embolisation, we had no clue about this, what it is. So we thought, okay, we'll try what it is. We called the hospital where we went and asked. They told they don't have this procedure. It is only a cut open surgery. So we didn't want to take that risk because after that, it is too long to heal. And so we waited and we called up Manipal Hospital and found whether this was available there. So we got to know they have the procedure of this. So.
Okay, thank you. Thanks for sharing that. With Dr. Nagbhushan, could you just tell us, obviously an incidental kidney tumor is obviously very common. We know that as we are doing lots and lots of scans, we pick up a lot of tumors. And one important message is that we don't really need to get worried straight away. I think it's important to meet experts, and I think hopefully that will come out of the discussion today. Can you tell us from the imaging or the diagnostic point of view, how we can scan these patients, what kind of scan and what we're looking for to reassure these patients as to if there is something to be worried or not?
I think initially, as in the case of Mrs. Gracie also, it was incidentally picked up in ultrasound. I think ultrasound is a very good modality to just reassure in the follow-up also, to decide whether we should go for any procedure or not. And definitely CT scan will add on to much points, like we can get to know about the blood supply to the lesion and all. So with the combination of these two modalities, we can make a fair choice whether to wait or to go for a procedure kind of thing.
Thank you. Deepak, sorry, just wanted to just labor this point, because I think it's important to just spend a little bit of time, because if we pick up a lesion on ultrasound and then it's a small, like Gracie has very kindly said, you know, that's 4 or 4.5 centimeters are cut off for an angiomyolipoma specifically. But how would you, as as a clinician, first of all, reassure the patient, and how will you then help the patient decide what is the best treatment option specific to AML?
Yeah, the first concern, as Gracie expressed, is any tumor it rings a bell about whether this could be a cancer. And there are lots of CT characteristics just mentioned, which can tell us clearly whether this is cancerous or not cancerous. So the first thing is to reassure the patient that this is unlikely to be cancerous. And second comes, how do we treat it? So I think all of us clinicians follow this policy, at least at Manipal, is do least invasive treatment first. Try treating medically. Next is least invasive. And if necessary, in some situations, go for a very invasive procedure. So clearly, when I saw her tumor and I realized that this is an AML, which is a non-cancerous tumor, I felt that interventional radiology would be the best choice, because it would be least invasive and all the advantages of quick recovery, early return to work, more comfortable. So I do guide my patients in this sort of sequence: simple treatment first, least invasive, and if necessary, rarely go to invasive procedures.
Yeah, I think we've definitely, teamwork, which is, I think, the highlight of being part of Manipal Group, is that we are able to engage with each other with a very transparent and open discussion, reach out to our patients to tell them and reassure them that, we got the experts who are contributing in the decision making. Obviously, at the end of the day, we want to empower the patients and they help, final decision has to be taken by them. Nagushan, I just want to come to you to just say that, can you just sort of go through the simple steps of the procedure of angioembolization, just to highlight on the points how it is beneficial over surgery, if at all?
Yeah, definitely. See, as Dr. Deepak and Dr. Uttapa has pointed out, this particular procedure, which is angioembolization for angiomyolipoma, is definitely a minimally invasive procedure. As we saw in the fibroids case also, we approach with a very small 2 to 3 millimeter incision in the groin area. And through this, we get into the feeder vessels, and we complete the procedure in a very magic point of time, less than half an hour time. And the recovery is also very quick in the recovery room for the patient. So the patient can be discharged on the same day or a subsequent day as the hospital policy. And definitely, the recovery to the work is much faster with angioembolization procedure.
Thank you, Dr. Gracie, did we live up to all what Nagushan just said from your own experience of what you had from the procedure point of view? Can you just share with us how it all went at Manipal for you?
Yeah, I got admitted and then I had to go to the procedure. I was clueless what it was going to happen, because embolization, first of all, no clue what it is. So they took me to the surgery, and it was on local anesthesia. They were doing the surgery, and I was able to see the monitor, what they were doing. So doctor also showed me, see, this is what is happening, and we have put a chip inside, coil. So it was nice to see also, and after the surgery, I came to the ward. I had pain, because after the surgery, it is common, we have pain. So after 2 days, the pain started reducing, and actually when the tumor was there, I never had any pain or anything was not there. So I didn't even know the growth was there in my kidney. Only after the ultrasound, I came to know. And doctor told after 4.5, if it ruptures, it's going to be dangerous. So,
You stayed in the hospital. were you in the hospital for the day? You stayed with us for a night?
Yeah, I was there for the next day also after the surgery. Something I want to tell.
Definitely, that is
Totally fine. I'm sure it'll come to you. From the recovery, like, were you able to get back home and get back to your normal chores quickly when compared to what we perceive in surgery? It may be a long recovery.
Yes, of course. It was very quick. In a week, I was able to walk and was back to my routine work. There was no pain, nothing. I didn't even feel I went through a surgery. It was all very nice.
Yeah, sorry, Nagushan, you wanted to come in.
One point, that is the beauty of this procedure. We are doing the entire procedure in local anesthesia, and the patient is able to hear and also visualize our monitors during the procedure. And we are also constantly talking to the patient during the procedure. Definitely, the pain part, what she's mentioning is maybe when we are blocking the vessel, there will be some kind of oxygen deprivation to the tissue that will elicit some amount of pain, but that can be tackled with routine analgesics, pain medication.
Can I just add?
Please.
Yeah, since we were talking about the use of interventional radiology, which is so smooth, quick, getting us patients back to work quickly, and also about organ preservation, I think it's very important that we talked about uterine preservation. Similarly, interventional radiology is coming in a big way for prostate. For males, the equivalent for the uterus is the prostate. And most men have prostate problems. We don't have that included in this discussion, but just for the education of people who are watching, even it is being used for prostate enlargement, and that affects a large number of elderly men, wherein we are finding a use for interventional radiology. And that it is a very exciting new field, and it should take us way forward in treating these patients.
Good. I'm sure that calls for another session next time on prostate. One point now, we've obviously treated Gracie. And I'm sure many in the audience are wondering, they're already wondering, I should get my kidney scanned, and what if I find something? Can you just tell us in few points what should be, specifically for Gracie, like what should be the follow-up, and what for other people who are out there who may have an incidental kidney tumor, what they should do?
Very importantly highlighted in the beginning of this session is the ultrasound has become a very commonly used diagnostic modality. It's there in every nook and corner of the city for any vague symptoms. People do get an ultrasound done, and because more and more number of ultrasounds are being done, we are finding more and more incidents of incidentally detected tumors in the kidney. So very commonly we see people coming with an ultrasound with something detected on and they are otherwise perfectly well. So the first advice here is to seek attention of a urologist who deals with kidney problems, and to ascertain what kind of a swelling has been identified on the kidney. And as was mentioned earlier, most of these incidentally detected tumors in the kidney can be treated by minimally invasive techniques, one of which is angioembolization, the others are robotic surgeries. So there is a quick and effective cure available for incidentally detected kidney masses. And the last part of your question, once a treatment like minimally invasive treatment has been done, it is important to have a good follow-up to see whether sometimes these tumors can recur. I mean, there's a 20% chance they can recur, so have a regular follow-up with the radiologist to see whether any signs of recurrence is happening.
Sure, thank you. I think we've covered all aspects related to this incidental benign kidney tumors, and what is really important is that one is to be reassured by meeting the experts. And I think, my personal message to people who are hearing out would be, don't take all the responsibility of worrying about it. I think you have experts, we have teams like Manipal all over India now, and I think you can reach out to experts and let them worry about it to some extent, discuss with them, ask the pertinent questions, and then make a conscious decision about what you should do. I think that's a very important message. Gracie, any final thought that you wanted to share with us related to what you just underwent?
Yes, those who have any problem at any part of the organ, you have to go to the doctor. Nowadays, we take it casually, not to go. It's a small pain, whatever it is. So I tell, whatever pain you have, and once in 6 months, do a scan. So you'll come to know what it is. If I had not gone for the scan, I wouldn't have known till it would have ruptured, I wouldn't have known anything. So we have to take care of our body. Our routine checkup is a must for everyone.
Thank you so much. Now, question, your final thoughts on interventional radiology, how effective in AML, and what do you think is the future scope for interventional radiology?
Definitely. Angioembolization is a very beautiful procedure which we do in our department, IR department. We have seen this in this case of treating angiomyolipoma and in previous case of fibroids, and as Dr. Deepak told regarding the prostate embolization also. Yesterday, I had to see one patient who was coughing blood in my emergency, and I was called in to treat the patient. There also, we could embolize the bronchial arteries and make the patient comfort, and it almost immediately stopped after my procedure. So that's the kind of angioembolization procedure which we do from IR. And these are gaining popularity, and every patient should, all of them should get awareness about such kind of minimally invasive treatments available by meeting their general practitioners or their doctors. Thank you.
It's a great boon to have an excellent interventional radiology team, all surgeons, gynecologists, surgeons from all across, from neurosurgery to cardiac to liver to urology, will be greatly, their work will be greatly enhanced if we have an excellent interventional radiology team, which we do have at Manipal Hospital. And these guys have helped us save many lives with minimal intervention when we have landed up in complications due to surgery, which do happen. But with such a good team being available, it can really do a minimally invasive procedure and save lives of patients. So it is excellent cooperation with you guys that we've been able to develop such a state-of-art service to the patients. Thank you.
Thank you. I think I couldn't really ask for a better way to sum it up. Probably in a very humble way, he said what he had to say. And I think, yeah, we want to just reciprocate. And one of the comments which I have made is, we always say radiology is the backbone or the pillar of any super specialty hospital. And I want to share that I think interventional radiology plays a huge role combining with radiologists in strengthening that pillar of any hospital. And I'm glad that we have this team in place. I think, once again, thank you to everyone who physically here and everyone who's connected to this program. Once again, a huge thank you to our chief guest and coordinating the whole thing, Dr. Bhavna and team, Manipal team, our clinical colleagues, and a huge thank you to Gracie and a lady with us who told us about the fibroid. Once again, thank you one and all for the session. I think we'll like to close the session now. Thank you.
Thank you, doctors, and thank you, Ms. Gracie. That was a wonderful session. Everybody, can we all hear it up with another round of applause, please? Thank you. And yes, we've seen how educating the patients about these procedures help them in taking an informed decision. And yes, we have patients like Ms. Rashmi and Gracie who have gone through these procedures with no scars and no bleeding, and then the patient generally gets discharged the very next day. I think this is amazing, and we have an amazing team from Manipal Hospitals. And can we have Archana also to please join us on stage? All right, so ladies and gentlemen, this is the team. Can we hear it up with a big round of applause to all the doctors putting in great efforts. Thank you very much, everybody. And yes, we've had 2 amazing sessions this morning. Thank you very much to all the doctors from Manipal hospitals. And yes, all right, so with this, I think most of us who didn't know what these procedures are, we've gotten to know a lot more about these procedures today. And yes, we'd like all of you to go back and tell all your friends and relatives also who are going through similar problems, where they have an option to choose where not to lose an organ at all. And yes, with this, we come towards the end of today's program. Thank you very much. I hope it was informative to all of you, and those of you who are watching us online, I hope it was informative. And coming month, we have the month of fibroids. So yes, save the organ, and that's what Manipal believes in doing, and they're doing a wonderful job so far, and let's keep that going. Thank you very much, and all of you have a great day. Thank you.